Hi Farmies! Today we are going to talk about antifungals and the systemic antifungal called amphotericin B. So amphotericin B is highly toxic. It's only used for life-threatening infections. And one of the things that can happen when you're giving amphotericin B, because it is for systemic infections like aspergillus and valley fever, because it's systemic, we give it IV. And when we give it IV, our patients can have an infusion reaction. The infusion reaction is fever and chills and kind of a muscle rigor. And it happens 1 to 3 hours after we start administering the medication. So what we do is we give a test dose of 1 milligram and we infuse it very slowly to see if the patient is going to have this reaction, because it's a fairly common reaction. In fact, it's so common that nurses have a nickname for it. We call it shake and bake. Chills and fever, shake and bake. Think amphotericin B, shake and bake. The next antifungal is fluconazole, also called diflucan. This one is given for candidiasis. So a vaginal yeast infection, you can take a single oral dose of this pill for a vaginal yeast infection. And the next antifungal that we're talking about is nystatin, and that's given for oral thrush. Remember, thrush is one of those super infections. You can get it after after an antibiotic has messed up your own local flora and fauna. You can have an overgrowth of yeast. So you can either take fluconazole if that overgrowth is a vaginal yeast infection, or you can take nystatin if it's an oral yeast infection or oral thrush. All right, so amphotericin B, systemic, big deal drug, big reactions. Other antifungals include fluconazole, which we give for yeast, and nystatin, which we give for thrush. That's all I have for you for antifungals.